Hey everybody, Dr. Jared Skowron from Spectrum Awakening. So moving on through our new Facebook Live series, kind of guiding you through A to B and helping your child with autism recover. So what we're going to be talking about today are labs. So we're going to talk about lab testing, what lab tests are out there, what lab tests should you get, what do the lab tests mean, what are they going to give for you, and we do lab tests basically to help us understand what's going on inside our kids so we can pick the best treatment. So anytime we're doing a lab, we want to know why something's happening and what I can do about it. All right. But you want to make sure, obviously, you order the right labs, because when you go to your pediatrician, you get typical labs. You get something like a CBC, you might get a metabolic panel, you might get a lead test, maybe a mercury test, maybe a vitamin D test if you're lucky. Those things are going to come back normal. Okay. And a lot of families, you'll tell me, hey, when I got lab testing back and everything's fine. Well, there's so many lab tests out there. I can't tell you the size. I don't think I have it here in my office, but I've got the lab book from Quest Diagnostics and it's this thick. They have thousands and thousands of tests. So we need to understand what's going on in our children so we know what to order and what type of test to order, what that's going to tell us, and then where we take that. So today what I want to do is review for you a lot of the testing that is out there so you can say, hey, these are the tests that I want for my child based on these symptoms, all right? Now, that being said, there are a lot of lab companies out there, okay? We have some lab companies on our website where we sell the labs and my interpretation. So if you order a lab on our website, you're gonna get the lab kit, you're gonna do the lab, and then I'm gonna get the results, I'll send you the results, and I'll send you a written interpretation based on what I find as if you were my patient, okay? So there's a lot out there, and there are many companies. There's a few companies that we think are great, and those are the labs that we have on our website, but there are other labs out there as well, and more are being created each day, and I don't know every single lab out there. I know the big ones and what they provide for us. So let's walk through those labs and kind of guide what you may want and what they're going to do for you. And again, if you want to get these labs, you can get them on our website. You can ask your doctor, get the labs how you can. I want to guide you to what you think you should order. All right. So let's walk through our different steps. What we've been talking about, over this new Facebook Live series, we talked about step one, why my child has autism. Were they born delayed versus having some kind of regression? Okay, then we talked about step two, making sure we balance brain chemistry. Number three, looking at inflammation of the brain, different dietary changes. Number four, treat the gut. And then number five, we're going to be talking about different labs. So this here, I didn't mean to have this here as a parent, when your child changes, but a parent said that to me during a telemedicine appointment on Monday. She said, we were talking about regression of their child. And she said, look, my doctor didn't believe it, but look, as a parent, what did she say? As a parent, when your child changes. Okay. So if anybody tells you this didn't happen, ignore them. Believe yourself. Nobody knows a child better than their parents, period. Usually the mother, but there are good dads like us out there as well. So you know what you saw. You've got to believe it regardless of what anybody tells you. All right, so let's walk through everything here. So step one being born delayed versus a regression. All right, so let me kind of give you an example of what that means. Some kids are born born delayed, okay? They never get their language, they never get their eye contact, things from the beginning. I just talked to a parent today over a telemedicine visit who said, my son was born with a high fever, and within 2 weeks, we just knew something was wrong, and we went and got evaluations done, okay? So those are kind of like, that's a big red flag that something happened from the day of birth or from the day of conception. The other story are those kids that are developing for the first 12, 18 months, get some language, get some words, get some eye contact, and then that regresses and goes away. That's much more common. So the first thing we've got to figure out is, how do we tell the difference between A, being born delayed versus regression, okay? What you're going to want to do are different genetic tests. So let me walk through the different genetic tests. And first, let me show you this research study, and these are researchers from Harvard, talking about genetic testing in autism and our findings reference the importance of genetic testing for toddlers diagnosed with autism, given a 12% yield. All right, what that means is they found genetic problems in 12% of the kids with autism, okay? And medical recommendations in response to that genetic testing was made for 72% of them. And that's really important because a lot of people think, hey, if I test my child's genetics and there's something there, well, I can't change it. That's true. You cannot change your DNA, but you can treat your DNA, okay? Let's say you have a genetic problem with your thyroid. Well, you can take thyroid hormones. You can take thyroid medication, okay? And that will treat that gene problem, all right? So many genetic things are treatable. Please don't think if you have a genetic issue, you can't work with it or you can't treat it, okay? So treatment for 72%, they found genetic problems in 12% of the kids. And what's another important thing here is the lack of phenotypic differences between subjects without pathogenic findings. Well, that's some really fancy words that mean some kids with genetic problems look different than a typical kid, okay? You look at a child and you're like, whoa, something's going on. What is it, all right? So many kids with autism who have genetic issues don't look any different than other kids with autism that have good genetics. So a lot of geneticists will look at a child and say, hey, this looks like a genetic condition. There's a problem here. That doesn't matter. You got to do the testing if you think your child was born delayed, okay? So that testing to do is called a CMA and a WES. We use a lab called Centogene. Centogene's the biggest genetic lab in the world. There are great genetic labs here in the US. This is the one we use because it's a cheek swab. So all you do is you get a Q-tip, or not, you don't use your Q-tip, you get a Q-tip in the mail from this lab, it's a special one, and you swab your child's cheek and get some saliva and get some cells and you put it in the mail and it's gone. Most genetic tests are blood draws. So we try to make this stuff that's gonna be easy for you to get samples from your child. So what you're going to get from a genetic CMA-WES test is basically looking at all the genes, every single gene, okay, in your body, and figuring out if there's a problem. So this person here, and this is a fake sample, this patient here has a gene called SETD6 that causes an autosomal dominant mental retardation condition, okay? That's going to be diagnosed as autism. So you're going to get that info. We're going to see what's going on. We're going to see what the treatments are out there. And it'll also kind of highlight other genes as well in this that might have mutations. And again, if you order this through us, we'll get the lab done for you. I'll give you my medical recommendations based on it. Or you can go to a geneticist or a neurologist and say, hey, I want this kind of testing done for my kid. Figure it out. All right. The next type of genetic test does not look at genetic conditions or genetic disease like that test does, but is called a SNP test. SNP is spelled SNP. A SNP test looks at the status of your genetics that make you an individual. So things like MTHFR that you may have heard of, or COMT, or MAO, or histamine genetics, or do I have celiac disease genetics, or do I have the genetics that I can't handle Wi-Fi, okay? Quick question from Dorota, how can I do this in the UK? Good question. The lab tests that we offer from our website are only used within the US, but you can contact these labs yourself. If you're out of the US, you can contact these labs yourself and figure out how to get them ordered. So like, for example, this Centogene company, this is actually out of Germany. So they do this testing in every country of the world. So you can contact the Centogene company and say, hey, I'm in the UK. How do I get this done? All right. Next is, again, the SNP test, things like MTHFR. This is a different kind of genetic test. It's not looking for genetic disease. It's just looking for who I am as an individual, which can really help us choose the right treatments. So you can get a genetic SNP test that's going to look at something like MTHFR. It's going to look at things like COMT that affects aggression and behavior. It's going to look at MAOA that affects aggression and sleep. You're going to look at vitamin D receptors. You're going to look at, here's a gene for histamine intolerance. It'll do histamine intolerance genes. So that's called a SNP test for genetics, okay? And that's really good too. Again, it doesn't diagnose genetic disease, but it helps us understand who our child is from a genetic perspective and how we treat it. The last genetic test out there is called a pharmacogenetic test. That's a very small genetic test that basically looks at what medications your child may or may not have side effects to. So if you are using pharmaceuticals, you should probably run a pharmacogenetic test to see which ones will cause side effects. So that's basically just a drug genetic analysis to say, hey, these drugs are going to have side effects. I should avoid those. These are meds that probably won't have side effects. So we use a pharmacogenetic lab called Tempus, and you're going to get an analysis, again, on the genes of these meds. You're also going to get an MTHFR analysis and a COMT analysis in this. And then you're going to get this whole list of medications that, and this is what you're going to get. You're going to get this whole list of medications that basically will tell you what medications you should avoid. So that's what a pharmacogenetic test is. So we've got all those 3 genetic tests on our website. You get them through your doctors either way, but those are the different genetic tests and what you should do about them. All right, moving on. Let's then talk about step 2, okay? Step 2 is balancing brain chemistry. Now, to balance brain chemistry, we've created this protocol called the Skowron solution, which is 4 different supplements that you take in a certain order that helps balance the brain chemistry and improve your language and your mood and your behavior, okay? It works great for my patients. But you may want to know, hey, I'm balancing brain chemistry. What are the levels of my brain chemicals to begin with, okay? So you can do that through an organic acid test or more advanced organic acid tests. So here's a research study that talks about the identification of organic acids are potential biomarkers in the urine of autistic children, which basically says, hey, this is the way that we can look at these things in kids with autism and what to do about them. Jessica just asked, is the SNP test a cheek swab too? So yes, the SNP test that we use is a cheek swab. Again, Q-tip, swab the cheek, send it in, you're good. The pharmacogenetic test that we use is a spit test. So you have to collect 1 milliliter of spit, which is actually more than you think. This company does not have a cheek swab yet, but I am really encouraging them to do so. All right, moving on to organic acid tests. There's 2 different organic acid tests that we have on our website. Again, there are many out there in the world. We use 2 companies. We either use Genova or Great Plains. Now, they're both very good, long-standing companies that do these tests. I kind of want to show you what an organic acid test would give you, all right? This is the one from Genova. An organic acid test will look at if you have bacterial infections in the gut, yeast infections in the gut. It'll look at mitochondrial markers. If you think you have mitochondrial dysfunction, you may have mitochondrial markers. It'll look at neurotransmitter metabolites. Again, these are the chemicals that help us understand what levels of brain chemicals we have. So you can do this urine test and find out, hey, this is probably the level of chemicals in my brain and I need to change them. Maybe my serotonin's deficient or my dopamine's deficient, so I'm not sleeping well or I can't focus, okay? It's also going to look at different vitamin markers. It's going to look at different toxic markers. It's also going to look, it's going to look at amino acids. So you get amino acid panels here, other B vitamin markers, other nutritional markers, dietary peptide markers, etc. All right. Now the Great Plains oat test also does very, very similar things, and I'll show you in a minute. The Genova test has something extra. We call this the super oat test. It basically also looks at your omega-3 fatty acids. So it's going to look at your EPA and DHA. Does my child need a fish oil supplement? What are his levels of fish oils? We can test that, okay? And this super oat test from Genova will also do heavy metals. You can look at lead, mercury, aluminum, etc. And we'll do a little bit of a mineral analysis as well. So that's the Genova super oat test. Now, if you're really interested in mitochondrial function, what you can then do is something called a mitoswab. So this is another test that we have called mitoswab, and it's going to look at the activity of your mitochondria. And again, why would I look at my mitochondria? Mitochondria produce energy for every cell in the body, and it's really problematic in kids who have low muscle tone, okay? Because the muscles need energy to stay contracted, to stay toned. So without mitochondrial support, you're going to get very loose muscles, big gross motor problem skills, fine motor problem skills kind of thing, okay? Now for the Great Plains oat test, which again I know is very popular in the autistic community. This is the Great Plains oat test, and again we've got this on our website as well. It doesn't offer the fish oil analysis or the heavy metal analysis with it. That's the other company, the Genova super oat test. Okay, but from the organic acid perspective, it's very similar. You're going to get analysis of yeast and mold. You're going to get analysis of bacterial infections. You're going to get an analysis of your oxalates. You're going to get an analysis of mitochondrial function. You're going to get an analysis of your neurotransmitters, your brain chemistry, all in this organic acid test. Okay, the oat test also takes a look at folate markers, other mitochondrial markers, other nutritional vitamin markers, as well as a little bit of an amino acid metabolite. It's not really an amino acid test, it's a little bit different, and other markers of detox. So this is what the oat test gives you. And again, why would I do the oat test? Well, I wonder if I have some kind of intestinal infections, or I wonder if I have mitochondrial problems or a brain chemistry analysis, a brain chemistry issue. That's why I would order the organic acid test. Also, as I mentioned, the Great Plains oat test does have some markers for mold. You can also order a mold test. So here's a mold test from Great Plains. It's called the Mycotox, and it'll look at different urine markers that suggest that you have mold in your body. And that can really affect mood, behavior. My kids in my practice that have mold issues are massively aggressive, hugely aggressive and angry. That's the sign of the mold issues for me. Okay, so you can always take a look at that. All right, moving on. What's next? We talked about step one. Am I born delayed versus regression? Okay, if I'm born delayed, you want that CMA-WES test. If you've had a regression, you probably want that SNP test. Okay, if you're going to do pharmaceuticals, get the pharmacogenetic test. Then we talked about brain chemistry. You want to look at a note test for that. Next, brain inflammation and diet. All right, so if you're going to look at what foods you should or should not eat, I would highly recommend doing a food allergy test with your doctor or with your allergist, and a food sensitivity test. Now, most allergists don't believe in food sensitivities. Why? They're allergists. They deal with allergies. They don't deal with sensitivities, okay? But we do. So you can get a food sensitivity test, which is usually known as an IgG test. This is the one we use through Genova. And again, it's going to look at 30 common foods and tell you if you've got a mild, moderate, or severe sensitivity. Now, you could have an allergy or a sensitivity or both, so I would highly recommend doing all the tests. Okay. Last but not least is, let's go back to here. Okay, we're going to figure out from a genetic perspective, was my child born delayed, or, is there a regression? We've got to figure out why there was regression. We're going to look at brain chemistry and balance it. We're going to look at what foods we should or should not eat. And then we're going to treat the gut, which is basically eradicating any potential infections that are in our intestines, like a stomach bug, but more severe, okay? So we got to look at candida, bacteria, and parasites. So we've got two companies that we use on our website. Again, there are many labs out there. You can use any one that you want, but if you think you got a stool infection, you got to do a stool test, okay? Or if you have an intestinal infection, you got to do a stool test. We have the stool test from Genova, which is great and is first generation. We got the stool test from GI Map, which is even more great and second generation. It's actually the same guy who invented both of these stool tests. The stool test through Genova is the same one through Doctor's Data, is the same one through Great Plains. And then this guy who created this first generation test went and made this other test, which is second generation. So I like the GI Map a little bit better, but we've got both of these to offer for you. So why would I do a stool test? Let me tell you what we can find. We could find how you're digesting your food. Is your child digesting your food? Or they have this big bloated belly because it's just full of gas, all right? There's also markers of inflammation. Do they have leaky gut? Let's figure it out. Also, we're going to look at prebiotics, okay? These are levels of things called butyrate, which is wonderful for you, or propionate, which is horrible, okay? So you can look at your prebiotic levels, or basically the chemicals that your flora create when they're exposed to the prebiotics. This is a probiotic analysis that you'll get on a stool test. And then every stool test is going to look at infections. So you've got, different bacterial infections, you got different candida infections, as well as different parasites. So it'll look at parasites here. Here's a myriad of parasites. Okay. Same thing on the GI Map stool test. You're going to look at different infections. Here's different pathogens. Here's different parasites. Here's different viral infections that you can look for. They're going to look at different probiotics as well. They're going to look at other different kind of flora, as well as different fungus and candida and viruses. And of course, you're going to get a parasite analysis as well. Here's a parasite analysis, and here's those digestive markers also. Okay, so really the only thing the GI map doesn't have is the prebiotic analysis, but it's got a better infection analysis. So a little bit different on both of those tests. Whew. Okay, so that's kind of an overview of the important tests that you may want for your child, okay? And again, the tests, you can get these tests on our website. You can get the tests through your physicians. I'm here to guide you. Why would I want different tests? So let me kind of review and then answer our live questions, okay? A, if you think your child was born delayed, if you didn't notice an obvious regression, or if your child didn't really have any kind of words or eye contact, you want to do this genetic test, okay? If they had a regression, then I would recommend the SNP genetic test to kind of figure out, what are the individual idiosyncrasies of your child, okay? Then you want to balance brain chemistry. You can start the Skowron solution, or you can do an OAT test, and from that OAT test, find all these different things about infections and mitochondria and brain chemistry and vitamin analysis through the OAT test. Once you start doing diet, get an allergy test from your doctor and a food sensitivity test. And then if you think you've got gut infections, you think you have candida or a bacteria or a parasite, do the stool test. Do the stool test and find out, and then we'll be able to really guide your treatment well. And again, we also added on the mold test if you think there's mold, or the mitoswab test, which is another advanced analysis of mitochondrial function, which is analyzed in the OAT test, but the mitoswab is a little bit more advanced. All right. So there's a lot of labs out there, okay? And you could do them all, or you can just kind of pick and choose based on your child's symptoms. So if there's a lot of gut symptoms, diarrhea, constipation, bloating, pain, order the stool test. Okay, if you've got a lot of behavior problems, sleep problems, then maybe this is a brain chemistry thing and you want to do an OAT test. Or, boy, you know what? My child doesn't respond to a single treatment I do. Any of those non-responders, any of the kids where you think they were born with something off, you got to do this genetic testing, okay? And again, can be through our website, can be through your doctor. You've got to get the right test to figure out what's going on. Okay, just like I mentioned at the beginning with your pediatrician, hey, I did this CBC and this metabolic panel, I didn't find anything. Well, you didn't look at the right